Many patients don't even know they have access to health insurance because they've never accessed healthcare before. So something bad happens, they go and call their family or friends across the border and say, "Oh, I got the best doctor here." They go and so many of them are diagnosed there. So the first thing is that they don't know how to deal with healthcare. I'm a physician, I don't know how to deal with healthcare. It's a very complex issue. So CRCD first comes in and educates them. Okay, they're a resource. Okay, you know what? You have access to healthcare, or if you don't have access, we'll try and get you help. So that's the first thing. The second thing is that they provide education to the patient. You know, where are you going to go next? Who is the doctor who's going to take care of you? And thirdly, you know, many of our patients are not financially well off, so they need logistical help. Who's going to bring them here? Who's going to provide the transportation for taking them to see a surgeon who is in San Diego? Who's going to be taking care of their kids when they are, you know, so everything from child care to doing their shopping to groceries, providing them with the necessary education. I don't even know how complex it was. I don't think they knew how complex it was when they first started out. And so they are like an extension of the family, but they are educated, they have the resources. I don't know how they advertise, but you know, there are campaigns to make people aware of this organization. So the first thing is, I hope you never need the resources for CRCD. But if you are somebody who has been diagnosed with a malignancy or has a family member or a friend who's been diagnosed, you know, reach out to your primary care physician, get the services of a medical oncologist. You can be immensely helped by CRCD because CRCD will help you navigate through this system very quickly. Even if they don't actually physically help you, by them making a few phone calls, by telling you where to call. So even if you have the right insurance, even if you have good doctors, even if you have all the resources that one should have, if you're running into any problems, you know, they will shrink the time for diagnosis, for being seen by subspecialists. Because, you know, cancer care is sort of a continuum. So they can help you in some ways in which you may not even know. And they are from this community. They have been around since 2006. It's not just the patients. I think that many physicians and nurse practitioners, physician assistants, they need to just know about CRCD, what kinds of help they can provide for any patient with malignancy. And there's a lot of research that goes on at CRCD. So they're well published, they're well recognized, and so you will be really doing a great service to yourself and to your community.